Virus is officially a pandemic, steadily spreading around the world. COVID-19 infections have now been confirmed in more than 100 countries and regions. In places like Italy and Iran, infection rates have been rising dramatically every day. But as the pandemic widens, China seems to be getting its own outbreak under control. New infections have dropped significantly, and for days, China has reported 0 new cases outside Hubei province, the epicenter of the outbreak. There have only been a handful of imported cases that officials say were people infected outside the country's borders. So how did China succeed in containing the virus?
China has taken one of the most ancient strategies for infectious disease control and rolled out probably the most ambitious and I would say agile and aggressive disease containment effort in history.
Bruce Aylward led the team of experts from the World Health Organization that visited China to observe its response to the outbreak. He pointed out some key measures China took that gave it an advantage in the virus fight. One is simply China's misfortune of being the place the coronavirus crisis started. That has become an advantage since it now has the most knowledge and experience in dealing with COVID-19. The first infections were reported in December 2019 in Wuhan, the capital of the central province of Hubei. Many of the first patients had visited this seafood and live animal market, which is believed to be where the virus started spreading. Local authorities have been criticized by Chinese citizens and the central government for not acting quickly enough, and even punishing doctors who first tried to sound the alarm. But once reports of the virus and its spread made headlines, Chinese President Xi Jinping ordered resolute efforts to contain the virus. The government immediately took drastic measures. On January 23rd, Wuhan, a city of more than 11 million people, went into complete lockdown. All public transportation stopped. Only cars with special permits were allowed on the streets. People have been blocked from entering or leaving the city by air, rail, or road. Those in the city have been ordered to stay at home. Limiting human interaction has reduced the risk of transmitting the virus, which spreads through moisture droplets, most often expelled when people cough or sneeze. Eventually, 15 other cities in Hubei imposed similar measures, locking down and restricting the movements of more than 60 million people. Fighting the virus became a national priority. China reallocated a huge chunk of its healthcare system to respond to the coronavirus outbreak. More than 20,000 medical workers from across the country flew into Wuhan and other parts of Hubei province to help treat patients. The government built new facilities specifically for patients with COVID-19. The move addressed the shortage of beds in existing hospitals and kept coronavirus patients isolated. China also took steps to ensure that patients with other illnesses would still get the medicine they needed while under lockdown. Authorities increased prescriptions to 3 months instead of the usual 1-month course. They also allowed prescriptions to be processed online and through the WeChat app, rather than in person. Healthcare providers also set up a system to deliver medication to people. China also made testing and treatment of COVID-19 free of charge. Though many hospitals were flooded with people reporting symptoms such as fever and difficulty breathing, the government covered the cost of testing, even if the results were negative.